Welcome to Chronic Conversations, the podcast that brings a voice to the stories behind chronic symptoms. I'm your host, Katherine Rose, certified integrative health practitioner, founder of Reclaimable, and soon to be published author. After years of battling unexplained symptoms and finally getting a diagnosis of Hashimoto's, I turned my pain into purpose. Now I help women just like you feel seen, heard, validated, and supported through community, coaching, and connection. Each week, I'll share insights from my own journey, proven strategies I use with clients, and conversations with fellow experts and warriors. You're not alone, and you can thrive. Now let's get into today's conversation. Hey everybody, welcome back to Chronic Conversations. I am so excited about my guest for today. Her name is Jodi Taub. She's a private practice psychotherapist with almost 3 decades of experience providing individual, couples, and families and group therapy. She specializes in chronic illness and rare disease, supporting patients and caregivers in managing health anxiety, medical trauma, and the psychological impact of living with complex health conditions. And in addition to her clinical work, she is a nationally recognized published writer, speaker, and researcher. She lectures nationally, facilitates support groups for patients and caregivers living with chronic health conditions, and contributes to professional education and advocacy within the chronic illness and rare disease communities. And I know she also had her fair share of chronic illness and experiences with that. So I'm sure she will share that today. And I cannot wait for y'all to hear this conversation. I can't wait to chat with her. So without further ado, let's get into it. Can you tell our listeners, even though I have introduced you a little bit, but just tell our listeners about yourself and just a little bit about yourself and what you do and maybe a little bit about your book.
Yeah, I can cover all of that. So you introduced me. I'm Jodi Taub. I'm a psychotherapist with a private practice in New York, and I support patients and caregivers who live with chronic healthcare conditions. So I do individual, group, family therapy, and I also speak and lecture on chronic healthcare conditions for patients and caregivers. And I wrote a book this year that was released in February, which is really exciting. And that's been on my bucket list forever. The book's called More Than a Patient. And the focus of the book is on the various relationships in our lives and how to work through them and how to improve them. So there's a chapter on all the different types of relationships. So friendships, caregivers, partners, caregivers, parents, friendships, mental health, medical relationships. There's even a chapter on pets. And how valuable they can be mindful catalysts. So I'm really glad that came out. It's sort of my gift to the patient community is a practical guide and to how to cope with living with chronic healthcare conditions with evidence-backed strategies, but also a little bit of my story. And so I'll lend into that about my chronic illness story because I think telling our story and our narrative is empowering. And that, I encourage people to do that because in so many spaces, we're told not to. And
absolutely,
is that we're not supposed to, and that there's a risk to it. In some cases, there is, like at work. But I have a disease called primary immunodeficiency, and that means that I don't make the appropriate amount of antibodies to fight off infections and viruses. So every 2 weeks, I receive other people's plasma, known as immunoglobulin therapy. And with that, because I'm missing part of my immune system, I have 30 different healthcare conditions that all decide to take flares at different times, and I have to manage them. So, I have a lot of autoimmune conditions. I could list off just to be relatable to some of your patients, but I have Hashimoto's, I have asthma and allergies, I have vasculitis, I have IBD. So the list goes on. And because of that, that's how I lended into the work I was doing. So I was a therapist before I started working with patients and caregivers and families. Although I've had all my healthcare conditions my whole life, I was diagnosed when I was 31. I'm now 51. So it's been 20 years.
Yeah.
It's my diagnosis date. And when I was diagnosed, I was approached by various patient organizations to start building out mental health programming. And I started lecturing and doing podcasts and working with patients and families and caregivers, because not only could I work within that context from a therapeutic perspective, but I got it. So
yeah, absolutely. About how long did it take for you to get diagnosed with
31 years.
Okay.
And very unfortunately, some of my other diagnoses came earlier. So I had, acid reflux and ulcerative colitis, and some of my and asthma, and those things came earlier because I was sick. But it's not uncommon. We know that 70 to 90% of patients living with primary immunodeficiency disease have not been diagnosed yet. And it's high week. So even though it's a rare disease, it's not as rare as we think. And so it took me until age 31 to get diagnosed. And it's not uncommon. Most folks living with PI, the average time from diagnosis is usually 8 to 15 years. And that could mean in adulthood. So there's people who get diagnosed as children, and there are people who get diagnosed in their 60s and 70s.
Yes. Yeah. It's wild.
Yes.
It's awful. So that's the case.
Yes. But the empowerment and for folks who are listening to this podcast who haven't been diagnosed and know that there's something wrong, and know that there may be a connecting factor, or there may be other healthcare conditions that haven't been diagnosed. It takes patience and perseverance to work through our medical system to get the right people to listen and hear and figure out what's going on.
It does. Keep going.
Yeah.
Keep going. You'll get there. And people like us are trying to advocate for you.
Yes.
Right? But
that's right.
So many of us, I feel like,
Yeah.
So for all of us with chronic illness, when we talk about grieving people and grieving different things and situations, my question for you as a therapist and that focuses on chronic illness and rare disease, how would you navigate or help somebody navigate the grief of losing the life that they expected to have, like losing a sense of self? Y'all, real quick before we jump back into today's episode, I want to take a minute to talk to you, especially if anything you've heard so far has felt a little too familiar. If you've ever felt dismissed, misunderstood, or like you're navigating your health completely on your own, I created something for you, and it's called the Kaya Collective. Kaya stands for Come As You Are. Don't worry, it's not another program or place just to get more information. It's a space where you don't have to explain your symptoms, prove your pain, or push through to just keep up. Inside the Kaya Collective, you'll find real conversations, support from women who actually get it, and tools to help you actually understand what your body is trying to tell you, but without the overwhelm. It's for women who are doing all the right things, but still don't feel right. The woman who's tired of surface level answers and ready for something deeper, and the woman who just wants to feel seen, heard, and supported. Again, if that sounds like you, I would love to have you inside. You can learn more at the link in the show notes, and I'd love to see you there. All right, let's get back into today's episode.
I think all of us do in some way, right? It's the grief of the expectation of what we thought our life was going to look like. And I think the grief of chronic illness, I also think it's chronic, because many of us grieve the parts of us that are no longer here, the identity we may have had participating in either work or a recreational activity that we felt attached to, that something that we talked about. And it's very hard when we have to grieve so many losses, right? And then there's the ambiguous grief that comes along with that too. And as I was just saying, the ongoing grief. So like what happens when we lose our ability in another way, or we lose another friendship, or we can no longer work. And so it's ongoing. And so I think part of living with chronic healthcare conditions is learning how to live and manage the grief. And part of that is the validation that it is real. Like those things are huge. And that identity piece that you were talking about of the life that we thought we were going to lead, because our chronic healthcare conditions at certain times take away the things that we wanted to do. And I think that's the hard part. And then I'm going to go to the resilience hope part of it.
Yeah. Okay, great.
Too, because it's like, we're like, oh God, it's another thing, it only brings terrible things. But, the truth is there are going to be things that we just can't do anymore. And we may identify with those things, and then we're no longer those things. And what happens when we grieve those things. And then the second piece is finding in the resilience of, okay, well, what can I do? And what are the things that I'm going to bring into my life where I'm at right now that will still bring me some joy and comfort and identity and purpose.
Yeah. And you can discover new things that, you wouldn't have otherwise.
Right. You're doing a podcast.
Right?
Right?
Right. Absolutely. Okay. That's awesome. Thank you for sharing that. You talk about relationships, all different kinds of relationships in chronic illness. And something for some reason I hadn't really thought about was the dating aspect and dating with a chronic illness. So, or any form of new relationship, how would you manage, the disclosure talk, like telling somebody new about your chronic illness and also being vulnerable, but also in the back of your mind, knowing that you haven't been believed in the past or that you've been gaslit? Like, how would you kind of guide that conversation or manage it?
I talked about that in my book, and I actually put it in like a 3-point plan to make it kind of simple.
Cool.
Who to tell, when to tell, and how to tell. And I think being mindful of those 3 things when you come into it, because just like you were saying, Catherine, at the end of like, when do I self-disclose? It's like, even, outside of dating, it's coming out, right? It's this process of like, who do I share this part of my life with? And for some people, so if we start with the who, when you're approaching dating, there may be some people that it's not worth saying anything to if you can. There's those of us who it's very obvious that we have healthcare conditions and there's no way to avoid that. But for those of us who it may be invisible in the moment, where you can kind of no one's seen your medicine cabinet quite yet. and you can sort of get around with some of the things that you're choosing to eat. It's just a choice of food. You may decide that you don't want to tell in the beginning. You may decide that this is something for me that I want to wait until I really know that this is somebody I'm invested in, rather than going through the vulnerability of self-disclosure. Now, there are other people who feel very empowered by it and want to tell people from the get-go and want to weed people out and are like, hey, this is what I got going on.
That's good point.
Yes. So that's what I'm doing. And so I think, but you have to be aware of that with yourself and what you feel comfortable with. Yeah. And then when to tell. So it may be that you don't want to strike up the conversation at the end of a third date when you're walking out the door.
Right.
Say goodbye, your goodbye kiss. Right. And by the way, but giving them that moment, doing it at the right time. Because one of the things you need to consider in dating is you've put all this time and effort into thinking about how your healthcare condition impacts your life. But that other person doesn't know. And so often we have a response where, if we say something to somebody, we're like, oh, that didn't land well, or they reacted this way. But we have to remember that the other person, this is not a part of their lives, and they may not have met someone else who has a chronic healthcare condition, especially for younger folks, and they don't know how to respond. So cut some slack for people too. I think that's important. And then I think, lastly, the narrative. it's important that you tell people how it impacts you. So, I may go in and lead and say like, hey, I've got, if I tell somebody, hey, I have a rare blood condition, and I get other people's bodies like every 2 weeks and I can't fight off infections, they might be like, what? How does that work? How are you functioning in the world? But if I'm able to say, I have a compromised immune system, I get infusions every 2 weeks, it helps me to stay healthy. I attend a lot of doctor's appointments. I do need to be careful when people are sick, but I live a full life. I still cycle and I still work out and I still see my friends and I still, work full time. These are all the things that I do. So I think setting expectations so that the person isn't just left with, oh, this is what you have. And especially many of the healthcare conditions out there, most people don't know what that looks like.
Right. Yeah. Totally. And I assume same structure in relationships, especially family members. If what you say is not received well and you don't feel believed, how would you manage that? What process?
Many of us are going to go through that.
Yeah.
Yeah. So that's, and I think that's par for the course. So I think expect that there is going to be that person. And those are the people where that's why the preparation helps, is where you protect your peace. And so you think about what you want to share with that person, right? So, and how that works. And so there are going to be people who don't understand and don't believe and doesn't make sense. And, and that's the case, but you have to manage your boundaries with that person. So if that person puts you at risk, there's certainly people in my life, they will continue to say, who do not understand my immunodeficiency and be like, oh, okay, why do you wear a mask? Especially after COVID, right? Like, you don't need to do that. And okay, that's fine for them. But are those the people that, like, if I know that person has a cold, am I going to be hanging out with them and go over to their house? No, because I know that they don't take my illness seriously and they would put me at risk and say, invalidate it and be like, oh, it's no big deal. It's a cold. It doesn't, right? Where for me, that's going to turn into like a multi-drug resistant organism, that's what I do. But that's
sure.
Gift. But I think you have to recognize that those people you have to set strong boundaries with. And if they put your health at risk, then those might be people you're spending less time with. That's
sure. And not everybody deserves access to your story.
100%.
Yeah.
Not everybody deserves access to your story. That's right.
And I feel like for me, as a recovering people pleaser, which I feel like a lot of people with chronic illness or autoimmune issues may have that in common as well. A while back, I did not have that mentality. And I felt the need that everybody needed to know, not because like, look at me, but, oh my gosh, what are they thinking? I had to cancel this. Things like that. What are other people thinking? Like I'm flaky or... Of
course.
Yeah.
Well, but that's a part of it too, right?
It is.
Because like that's, because people do think that, right?
They do.
They do. I mean, that's the truth, is they are going to judge you. And
yes,
all inconsistent capabilities. The judgment comes in with the invisible illnesses where it's like, oh, but you were able to do that like a month ago. So I don't understand. Or you attended that event, but you're not going to this event. So maybe you're just not that sick, right? Or
right.
And people do that. So how did you learn to protect yourself?
Time and experience. And I think getting so worn down by that act and others similar. And after, I think, going through a divorce too, just realizing that this is my story to tell. Not everybody has access to it. And having love and respect for myself and learning that I need to protect my peace, as you say, and my energy. And, I know what's true and I know what my body's going through. And if somebody else wants to not believe it and take what they want, then I have no control over that. And that's been pretty freeing for sure.
It's empowering.
Yeah.
Because you take the power back, right?
You do.
Because when you feel that you're worried about how you impact everyone else, right? But they're not thinking about you. And then you take the sort of control over that and set boundaries and limits, then you're able to navigate how those things work. But also you're setting expectations for other people too.
Mm-hmm. Yeah, absolutely. And it's something I don't feel like you can be, well, maybe you can be taught that, you can be told, but it took me lived experience to, I guess, accept that I don't have control over that or what have you. But it feels good.
Yeah.
Not necessarily to be sick, but to take that power back, like you said. So my next question has to do with gaslighting. We're going to take it kind of to the medical side. So if a listener or whoever have experienced medical gaslighting, which most of us have to some extent, I feel like, what is one practice or boundary that has helped people to start rebuilding trust in the healthcare system?
Yes. Well, I think we've all experienced medical gaslighting if you've gotten to this point and you're on this podcast. And I think if you can look at it from a larger perspective, is like we have a broken healthcare system. And right now we're on a conveyor belt for healthcare that doctors have limited time with us. They have limited information. And if things aren't solved or our healthcare conditions don't go in a particular direction, or it's not their expertise, or they don't have time, things go awry. And I think it's important to remember that this is your life and you have the right to be able to approach and take your healthcare in the direction that you want, and that it's a mutual relationship. And I think that there becomes a power dynamic that often happens, especially if you're in an emergency, right?
Yes.
Emergency situation, you have no choice, right? And how to navigate those circumstances. And I think part of this is planning. So, I always tell people, go in, have whether it's in an email doc or you have it with you, you have your list of all your healthcare conditions, you have a list of your medications, you have a list of your physicians, and learning how to navigate it for yourself, that if there's a person who does not believe you, doesn't understand you, okay, then I probably need to interview someone else. Sometimes we don't have a choice, right? So we might there might be a doctor that's the only specialist we have, or we're in an emergency. But then navigating and talking to the person and whoever that healthcare provider is and say, hey, by the way, can you talk with this physician? Can you talk with my rheumatologist? I didn't make that decision, but you can speak with them. But I think part of it is taking control over that yourself and seeing it from a different perspective and trying to figure out the best outcome. And some of those relationships can be repaired. You're not always going to agree with your doctor, Right. Several of my doctors met, that we may see things from a different perspective, and, we may want to approach something differently, and we negotiate and we talk about it. And this takes time. Right? When you can, it's finding the right people to care for you and navigating the experiences around that and as best you can.
Yeah. Your team of doctors, do they all communicate? I know in some cases that is the case. In some cases it's not, on an as needed basis, maybe.
Some of them do. Most of them do. But it requires a lot of work on my end.
Yes.
Taken years and years to do that. And I'm the medical case manager. And that's what's happened with our current healthcare system is we now become the medical case manager.
Yes.
Us are having to email and send documents. We weren't allowed to do that 10 years ago, 15 years ago. And that has been a significant change. And so healthcare providers were forced to do the case management before because it wasn't HIPAA compliant. Now we can, get on and send our docs and all that kind of stuff. But many of mine do, but it has taken years and years of work to get that.
I'm sure.
That, yes.
I'm glad they do.
Yes, they do. But it's taken a long time and the work is worth it. And I think it's finding also to building those relationships. And that's, I think, really important too, to remember is our medical relationships are very, very important. And with the same intention that we put into romantic relationships and friendships, we have to do the same thing with our providers too.
Yeah, that's well said. Very good point. How we as businesswomen or moms, we are carrying a lot, whether that's physical, emotional, all the things. So what do you find in I think you refer to them as patients, not clients, patients, their biggest internal barrier when trying to practice self-care? And how can rest be reframed as a necessity and not a luxury?
I'm so glad, Catherine, that you brought this up because women bear much of the burden.
Yeah.
Right? And especially women who live with chronic healthcare conditions carry a different burden because women are meant in our society to be natural caregivers, right? So we look at women to caregive for their significant other, to caregive for their children. And that expected societal role is that we're supposed to, or our aging parents, we're supposed to put everyone else first. And so, and the truth is, and things are changing in society, but those same expectations are not met of men. They're not.
Yeah.
And because of that, then you have this added burden and expectation, and then it can make some women feel like they're less than, or they're not meeting expectations, or they can't. And it takes a toll. And I've seen this in particular with the women patients that I've worked with over many, many years, because we're all caregivers too. And so we are, and it's hard to be a caregiver and a patient. So, and I think rest is key. Rest is key for all of us. It's a non-negotiable.
It really is.
It's a non-negotiable. And our bodies tell us that. So, our bodies shut down when when we're in overwhelm. Our mind and our emotions do too, trauma response. So I think it's important that we shift how we see rest, that it becomes something that's a part of managing our healthcare. So making sure that, and part of that is saying no to people.
Yes.
It's saying no. And, as women, we have a hard time doing that.
Yeah.
And it's hard to say no when people continue to ask. And we do not value rest in this society at all. We encourage people to, burn the midnight oil.
Push through.
That's right. But you have to. Our bodies need it. It's integral.
Yes. And with autoimmune and lots of other chronic illnesses on the rise, it's definitely, I don't know if you want to put the word epidemic on there. I don't think that's the case, but I know it's on the rise. And so many women are feeling off and unwell. And I think the just push through mentality is definitely contributing.
That's right. And you have to set those limits and boundaries. And I think, here's a positive spin on managing healthcare conditions is that we learn to prioritize our health. Society does not do that. We prioritize pushing through and work and managing and doing a million different things. And you're exactly right. It is. 1 in 4 people live with chronic healthcare conditions. That's a small amount. And when we don't rest, it just continues. And I think in this day and age now, people having access to you at all times and with social media and with, people are not getting that time to disconnect. So not only do I encourage the physical rest, but you need the mental health rest.
Absolutely.
Need it.
I feel like we're feeling it now more than ever.
Yes.
The constant access to you and just the constant pings. And it's crazy. When you were saying something else, it brought something else to my mind. And us, the chronic illness community, we oftentimes, if we're asked how are you doing? We don't know how our response is going to be met. And so, or I can speak for myself, I'm not trying to speak for others. A lot of times I'll say, fine. Because number one, we don't want to be a burden. That's just a mentality. And also we don't know, again, how the response is going to be met or perceived. Have you worked with patients that have felt like a burden or expressed that they always feel like a burden? And I'm sure that probably contributes to.
I think we all do.
Yeah.
I think we all do. I don't think there's a single conversation that comes up that doesn't have that constant negotiation of you're aware that in some way your healthcare condition is impacting that other person. And in a way, that they don't have to think about. So we're having to kind of tackle that. And I think that's part of why I focused on my book on relationships, because the number one thing that people talk about and struggle with is how to navigate that. Like, how do I navigate myself as my person? And then the way in which my healthcare condition impacts my significant other, my friendship, my parents. It's like there's so much stuff, it's in every other way. And then we feel the judgment or the burden of other people. And it's very, very challenging.
Yeah. It is. Do you have like one or two tips or takeaways for those with chronic illness navigating that?
Yes. So I think it's setting limits and expectations, and then reminding yourself of the ways in which you show up for other people and reminding them. Because I think what ends up happening is we think of our deficits and our burdens. So we go into negative mentality. But the truth is, like, we show up for people in a lot of different ways. And reminding yourself of the strengths. So when you're feeling like, oh gosh, I feel like I've been talking, I've had a really bad flare and I've been talking to my friend about my healthcare condition and how bad things have been. And I'm talking about it all the time. Well, okay. Have you showed up for that friend when they were going through a divorce, or when they were dealing with some issues with their kids, or when their parents got sick and they were carrying that load, and reminding yourself of the ways in which you can show up. And then I think the other part is having that conversation. So being able to say, like, okay, these are some of the limitations I have, but you know what? Here are some of the things that I can do. And can we find, a happy medium? So I have a client of mine who their parents are ill right now. And so her sister is taking on like in person, going to the hospital and those sorts of things, because it's really hard for this particular client. But she's doing a lot of like the back end work of like the case management and the medical management and some of those things. And it's okay, I can show up in this way. This doesn't mean I'm not showing up. It's showing up in a way that is safe for me.
Yeah, I like that. How would you tell somebody or help somebody manage specific anxiety that comes with medical uncertainty in general? Or we've been there, the lack of diagnosis, having these symptoms, being told, your labs are normal, and the ongoing unknown. And am I always going to feel this way? Will I never have an answer? I could go on and on. But
yeah, I think ground yourself in knowing that something is wrong and you're not making it up. You're not imagining it. Why would you?
Right.
Why would anybody do that? But it may take some time in the way that our healthcare system works right now. Like, we don't have those practitioners who are holistic and see the whole picture and spend an hour and a half or 2 hours. And it may take you upping the ante and traveling. It may take you going somewhere. It may take you, you may have to travel and go to the Cleveland Clinic or Mayo Clinic and find some more answers, or look online and figure out where patients are going. But hold on. Inevitably, you will figure out and find the right person who knows how to treat you. And many of the chronic healthcare conditions that do exist, and especially I know this all well myself, like I live with a rare disease, and many of the patients who have lived with various rare conditions and caregivers, it took them years of going to NIH, finding different providers. But I think the biggest takeaway I can give you is don't lose hope and find the right people. Keep going until you find the right person who knows how to treat you.
Yeah.
And sometimes it's finding someone who just knows how to treat you. Maybe they treat your symptoms and they don't know where it's coming from because they don't know the name. Like so many of the diseases now that are being named, like POTS, dysautonomia, EDS, like I've been seeing patients with these diseases for years and years and years. Back when it was considered very rare. I started seeing EDS patients almost 20 years ago. And there were a few doctors in the United States who we're treating them. Like that happens. And now you can look on the internet and people know what that is, and you've heard of it. So there are many of the chronic healthcare conditions, more and more diseases are being discovered, are being understood. So don't give up.
Yeah. And communities as well, with women and people sharing their experiences and learning that you're not alone and also feeling validated are two really, really helpful things or experiences.
Huge. The peer community. And you reaching out and you doing that, Katherine, too. Right? You're
Both
building,
are. Yeah.
right? We need community.
Sure. Yeah. I remember how isolating it felt and how anxious I was. And once I didn't think there was anybody out there at all experiencing similar things that I was. And it's just not a good feeling. So the moment I started talking and finding people that were experiencing similar things, it was life-changing, really.
Right. And sometimes it takes a while, like even if you do get diagnosed, to find the right people to treat you.
Sure.
The right relationship. So it's persistence.
Yeah. Persistence, self-advocacy, not giving up, and doing that all while you're not feeling well is not a treat for sure.
Right. And managing everything else.
Yeah. It's a part-time job or full-time job all in itself.
Yes, that's right. But I do think that journey, when you haven't yet figured it out, and you brought up something important too, is like, it's isolating.
Yeah.
Because you question yourself, like, am I really, am I really thinking this? Maybe it's not happening. Maybe it is happening. And, and you go back and forth. And especially when you've gone into the doctor's appointments and they tell you everything's fine.
Right. And then you're like, am I imagining it? Am I crazy? Maybe.
Yes.
You're not.
Before I got diagnosed, I think I was in my 20s, and I was living in Chicago, and my doctor, I was sick again, and I had another sinus infection that wasn't working. And she's just like, and I call her, she's like, Jodi, I don't know what to tell you. Some people just don't get better. Yeah. And she was probably frustrated. She's with her kids. I'm sick again, and she doesn't know what to do with me. Right. And I was like, okay, this is where I'm firing you.
Yes.
Because
good for you.
Right. Because I was beyond her expertise. And there are going to be people who are beyond your expertise. Not everyone knows how to treat all the healthcare conditions. They don't. And we think that when we go into doctors that they know. Most doctors, and especially now, there's so many new healthcare conditions that are being discovered, may not know anything about your disease. They used to, I would go in the hospital and they'd be like, hey, meet this person. I've never met her, but I've never met somebody with a primary immunodeficiency disease. Now I'll go in the hospital and people actually know what it is 20 years ago, but they didn't 20 years ago.
Sure.
Yeah. So, hold on to hope.
Absolutely. And a lot of them aren't trained in this way. And I don't know a whole lot about that and what they're trained in, but I've read.
Yeah. Well, and even with, so many of the autoimmune conditions too, and I have multiple autoimmune conditions too, like a lot of the symptoms that start happening, most people wouldn't know, oh, wait, that's an autoimmune condition, right?
Sure.
Or endocrine.
Mm-hmm.
Right? Like we just don't know.
Right. No, absolutely. And to your story, when I was going from doctor to doctor and specialist to specialist, I remember I had started doing my own research finally. And because for a long time I would rely on and trust and believe whatever the medical professional was telling me. And there's nothing wrong with that. That's totally fine. But I remember after researching, I asked, I think it was a GI specialist, do you believe in leaky gut? I don't know what I asked him, something along those lines. And he was like, nope, it's not a thing, or something like that. And I was like, all right, bye. I didn't say that to him right then, but I didn't.
Not the right fit, right? Mm-hmm. Not the right fit. And you and I are two examples of that, of like, okay, we knew something was wrong and we had to keep going.
Yeah.
Till you do.
Right. In the integrative world, that's how I finally came to a diagnosis, and that won't be the case for everybody. But I originally thought they just wanted to sell you supplements. That was the impression and what I was told and what I had heard other people say. So I didn't go that route till I finally did.
Yeah. And it's finding the right route for you, right?
Yeah.
What's going on with you. And also it's finding the right person.
Yeah.
Sometimes it's just meeting that one person who wants to get to the bottom of it.
Yes. And they're out there.
And they are out there.
Mm-hmm.
They are out there.
For sure. I can't believe we're almost coming to the end of our time. We've covered kind of a wide range of things. Is there anything else you want to add for our listeners that we haven't touched on? I'm sure there are many things. And then, I don't mean to interrupt you. And then also tell us where everybody can find you and put in the name of your book again and things like that.
Yes.
Okay.
So I guess this will kind of lead into my book, but the quality of our relationships will impact the quality of our lives. And the investment that you make with the people in your lives, whether it's, your physicians or your friends or your parents or your romantic relationships, work on building that connection so that they can understand our experience and support us. Sometimes people just don't know how to support people living with chronic healthcare conditions. So don't up on the people in our lives, because yes, there are going to be some people who are not meant to go down the road, but there are others that are worth it. And if you can bring them into the fold and help them to understand, and it will improve your quality of life, because we have to have the people that support us around us. Like that's what makes all of this worth living. That's it.
Yeah.
And so I know what happens when we live with chronic healthcare conditions. We're so focused on ourselves and doing all our stuff and everything else. But I think make community care a priority.
Mm-hmm. Yeah. Love that.
Yeah.
And tell us, and we'll include this in the show notes as well, and a link to where people can buy your book and things like that. But where, like Instagram and everywhere.
So yes, my Instagram is Chronic Illness Therapist. So you can find me online and you'll see my picture. But I am on Instagram and I do post about chronic healthcare conditions, post about mental health. I post my lectures and videos in support of the chronic health care community. You can find me on there. You can find me on Facebook under my name, and you can find me on LinkedIn under my name as well. And all of those places, which, I hope to see all of you. And then if you're looking for my book, it's More Than a Patient, Building Relationships and Creating a Meaningful Life When You Have a Chronic Illness. And you can find it on Amazon, Barnes and Noble, Strand, online. And the benefit to the patient community is the ebook is sponsored for free for the first year through February of 2027. So
that's awesome. I appreciate your time so much. This was so much fun. I could talk to you for hours.
I know, Katherine. Hopefully it was so nice. Thank you for having me today. I feel like I could keep talking with you too.
Yes.
It's like I want to ask you the questions.
We can do that next time.
Yes, I would love that.
Okay, awesome.
Thanks so much for having me.
You're welcome. Thank you so much for joining me on this episode of Chronic Conversations. I hope you're walking away with a little more clarity, hope, and inspiration for your healing journey. If you enjoyed today's episode, I'd love for you to like, subscribe, and share it with someone who needs it. Every share helps this show reach more women who deserve to feel seen, heard, validated, and supported. And if we're not connected yet, come say hi on Instagram. You'll find me at Reclaimable, RECLAIM.able, ABLE. Plus, you can check out free tools and resources anytime for your wellness journey at Reclaimable, RECLAIM-able.com. And until next time, take care, and here's to thriving well, no matter where you are on your journey.